It's all yours, Shawn.
All right, well, great. Thank you. Can you all hear me okay?
Yes.
Great. Good morning. I hope everyone's doing well. Thank you all for your patience with me, and I appreciate you guys rescheduling me so quickly. Delighted to be here, Ms. Cheryl. Good to see you once again. And today I'm here to talk about common healthcare scams. So I'm going to share my screen, and this will take just a second. All righty. Can you guys see my screen there?
Yes.
Great, great. So as I said, we're going to talk about common healthcare scams today. And just by way of agenda, we're going to do an overview of what the Senior Medicare Patrol is, what we do, and how we do it. Then we're going to look at the top healthcare scams we've seen affecting seniors over the last few years, followed by ways to prevent, detect, and report those scams. And then, of course, questions. And as Gary said, we'll be taking questions throughout the presentation. So feel free to jump in and ask, and I'll do my best to answer those as we go along. So that said, the Senior Medicare Patrol itself, it is a program and its whole focus is to empower seniors, family members, as well as their caregivers to prevent, detect, and report healthcare errors, healthcare fraud, and healthcare abuse. And we do that through outreach, we do that through education, and we do that through one-on-one counseling. The program itself is sponsored by the U.S. Department of Health and Human Services, and it's under a division they call the Administration for Community Living. And so they provide grants to all 50 states to run programs like this in each state. And in Virginia, the organization that received the grant is called the Virginia Association of Area Agencies on Aging. And so the Area Agencies on Aging are groups that we call AAAs. And there are actually 25 AAAs around the state of Virginia. So you may have a local area agency on aging there in Arlington. It's actually in the city offices over there. And so there are actually 25 agencies like that around the state. And so we partner with all 25 to administer this program. So in each of those agencies, I have paid and volunteer staff that do outreach. They go into the community, they do set up tables at various events, whether it's an outdoor event or indoor event for seniors. And they give out information to seniors so that they can help keep themselves safe from fraud. But we also do educational programs. So much like what we're going to do today, we have presentations on not just healthcare scams, but we talk about various types of scams, such as AI scams, email and text scams, as well as just a whole array of the imposter scams that are out there. And so we show up at churches, we do virtual presentations like this, of course. We go to AARP meetings, NARF meetings, anywhere there's seniors. We say we'll even show up at your cookout if you share your hot dogs and hamburgers with us, but we want to make sure seniors get this information. So we do outreach, we do education, and then we do one-on-one counseling. We have a 1-800-FRAUD hotline where seniors can call and get free assistance if they feel like they're a victim of scams. And so they call that number and we walk them through whatever steps it takes to help them get those situations resolved. And then finally, we love to give out resources. So in addition to what we give out at the outreach events, we also ship resources to individuals or groups that are having events. So if you call us and say, hey, I need some folders, or hey, I need some brochures, tell us how many, we'll ship them to you for free because, of course, we want seniors to get the information that we have. And so that's an overview of the Senior Medicare Patrol. We're going to go ahead and jump into the top healthcare scams we've seen affecting seniors over the last few years. And these three types of scams that we're going to talk about are the three biggest ones that we see. We actually get phone calls on these particular types of scams every single week. And so first, we're going to look at what we call government imposter scams, followed by DME or durable medical equipment scams. And then we're going to look at the genetic testing scams. And so, starting with the first one, the government imposter scams. These are scams where people are imitating or impersonating members of the US government. We've seen them impersonate the IRS. We've seen them impersonate the Social Security Administration, but they also impersonate individuals from Medicare. And so they'll call seniors on the phone, they'll get them on the phone, and they'll ask them, did you receive your new Medicare card? Well, every senior they call, the answer is going to be no because Medicare is not giving out new cards. And so they claim that it's a new card, that it's a plastic card or a platinum card or gold or green or silver card. But whatever kind of card they say it is, it has all these extra benefits. And since the senior hasn't received it, they say, hey, we can help you get your new card. All we need to do is verify your Medicare number. And really, what they're saying is they want you to give them your Medicare number. And the reason they want this number is because this number is valuable. It's attached to all of your benefits. And so what scammers will do is they'll take this number and they will put in false claims to Medicare in hopes that they get paid by these claims. And if they don't do that themselves, they will sell this number to people who will try to do that. And so if a senior says, well, I didn't get my number, or I don't feel comfortable sharing my Medicare number with you, then the scammer starts to threaten the senior. They'll start to say things like, well, if you don't share your number, you won't get your new card. They'll claim that your old card won't work anymore, and then say you have to pay out of pocket for all your medical expenses if you don't share that number or verify that number. Unfortunately, a lot of seniors get afraid based on the things they tell them, and they end up sharing that information. And eventually, of course, scammers end up getting away with their card and their number. And so just again, just keep in mind that Medicare is not giving out new cards. The paper red, white, and blue card that you have is the only card that you need. That said, the second type of scam that we see most often is what we call a durable medical equipment scam, or DME scam. And this is a scam where people are trying to get seniors to receive free durable medical equipment. Now, durable medical equipment is basically any equipment that you would use more than one time. So a wheelchair, a walker, a rollator, but also things like back braces, leg braces, and arm braces. And so they call seniors and they'll claim to work for Medicare or someone associated with their insurance company. And then they claim that they have all of this free equipment that you are entitled to. All you have to do is ask for it. Because you pay your premium every month, you're entitled to this equipment. And so then they start to diagnose seniors over the phone. Do you have back pains? Do you have arm pains? Do you have leg pains? Well, if you ask anybody over the age of 25, 35, if they've got pains, they're going to come up with something. And so someone might say, well, back in the day, I played a little bit of tennis. Maybe I've got some tennis elbow. Maybe I can use an elbow brace. The scammer on the other end of the phone says, great, we can get you that brace. Give us your Medicare number. We'll get that processed for you. If the senior provides the Medicare number, one or two things might happen. One, they may never hear from this person again because, again, they've got that Medicare number, and that number alone is valuable by itself. But what we've seen happening instead is a senior that said that maybe they need that elbow brace. They'll get a box a couple of weeks later, and in that box will be the elbow brace that they've asked for, but there'll also be about 4 or 5 other braces that they did not ask for. Now, the average person will take that elbow brace and put it on, and then take that box and put it in the garage, or they'll put it in the closet, thinking that, maybe later I can use one of these things, or maybe my kids can use it down the road. But the problem that we run into is that now everything in that box has been paid for. And when you think these braces are going to be high quality medical braces, they're going to start at least $200 a piece. So if you take 5 braces at $200, that's $1,000 that's come out of the Medicare system and is now sitting in the pocket of a scammer. And those braces are just going to waste because no one's using them. And so we know that the US government spends about $800 billion a year on Medicare, but they lose 60 to 80 billion dollars to scams like this one. And the sad part is that seniors are going along with the scam and taking the money out of the Medicare system. And because Medicare ends up paying those bills, which means that we all end up paying those bills because we pay into Medicare. And so the scammers are getting away with our money. So we want to make sure seniors are aware of this type of scam and they're not falling for it. The last type of scam we're going to look at is similar to the DME scam. It's called a genetic testing scam. And this is a scam where they're trying to convince seniors to participate in a genetic test. And so they'll sell it as valuable. They say that the tests are so advanced these days, what we can do is look at your DNA and see if you have markers for various types of diseases. Now, they may call it a genetic test, they may call it a DNA test, they may call it a cancer screening or some type of blood or hematological screening. But basically, they're going to claim they can look at your blood and see if you have markers for various types of diseases, like a cancer or heart disease or a lung disease or something. And then they say that if we find out you have this marker, later on, if your kids or your grandkids get sick, we can test for these things first because we know that's a possibility and we can possibly save their lives. And so anyone with kids or grandkids would want to go along with some type of test like this. So they claim it, they sell it as valuable. They claim that Medicare will pay for it. And then they talk about how non invasive it is. All we need is a cheek swab, just like we would with a COVID test. Or we just need to get you to spit into a tube. We just need to collect some DNA to run this test. So if a senior says that yes, they want to participate in this, what typically happens next is a week or so later, they get a box in the mail. They open that box, there'll be some paperwork for them to sign. They'll sign the paperwork, and then will be the little kit where they either spit into a tube or they swab their cheek. They do one of those two things. They seal all of that stuff back up, put it in the box, they mail it off to the lab. A few weeks later, the lab will send some results, and then they'll send a claim to Medicare. And every single time, Medicare is going to deny that claim. Medicare only pays for these types of tests under very strict conditions because these tests are expensive. They pay for it when your doctor prescribes it, and only when he can prove that in your chart that this test is absolutely medically necessary. Without those two things, Medicare and other insurance companies will deny the claim. What happens next is that the senior gets stuck with the bill. They send that bill to the senior, and the senior gets stuck with it. Now, we've seen these bills be as low as $800. We've seen these bills be as high as $12,000. So we don't want seniors getting stuck with this. And the reason they get stuck is because they've signed the paperwork that was in that box. And the paperwork says that if my insurance company doesn't pay for it, I'll be glad to pay for these tests. Even though they claim Medicare will pay for it, uh, because that senior signed that paperwork, they get stuck with it. At that point, law enforcement's not going to jump in. They're going to ask, did you read your paperwork? Medicare's not going to jump in because they're out of the loop. They don't pay for these tests. And the beneficiary ends up getting stuck with the bill. And so we want to make sure that people are aware of this and they're not participating with these scams. So as I said, these are the biggest types of scams that we see. We get calls from these all week. They're government imposter scams where they're talking about the Medicare card, the durable medical equipment scam where they're trying to get seniors to receive this free medical equipment, and then the genetic testing scam where they're asking seniors to take this medical screening. So with that, we're going to look at ways to prevent, detect, and report each of these scams.
Shawn,
On the
before you do, we do have one question that's come in.
Absolutely.
Uh, this person says, it's my impression that the government never calls you. If someone says they are from the government, that you should ask for a phone number where you can call them back and confirm that they are who they say they are. Is this true?
That is correct. And we're going to get into that right away. But yes, government agencies do not call you.
Okay, thanks.
All righty. So looking at ways to prevent, detect, and report. One, we say to seniors, don't answer unsolicited phone calls. Now, an unsolicited phone call is a phone call where if you look at your caller ID, it's just the number that's popping up on the screen. You don't have a name, you don't know who it is, you're not expecting a call, and you don't recognize the number. We say always, always let those calls go to voicemail. If it's an important call, they're typically going to leave a message. Doctors' offices leave messages. Pharmacies will always leave a message. If they're trying to schedule an appointment, they're going to leave a message. But generally, important phone calls, they're going to leave a message. And even sometimes scammers might leave messages. But the idea is you want to be able to screen those calls so that you know who you're talking to and that you can verify that it's someone that's going to be legitimate. Now, a lot of seniors will tell me, the phone rings, I don't mind answer it. I hang up if it's a scammer, or sometimes I harass them if they're scammers. They ask me dumb questions, I give them dumb answers. Or I had a gentleman and a young lady said they have a whistle they blow into the phone or an air horn. But here's the problem with that. We got to remember that these scammers are opportunistic. And so, first, they're stealing information, which is how they have your number to begin with. So, they're doing data breaches and they're breaking in and stealing information. Sometimes there are bad actors in good places, meaning that there have been people in doctors' offices that work there that have been prosecuted for selling your information out of that doctor's office. And then sometimes they're buying your information legally. If you've ever been on a website where they have a privacy policy, some of these privacy policies will tell you that that we sell your information to our partners, to our marketeers, or to our advertisers, and people can buy that information from data brokers. But in any case, if I'm a scammer and I have stolen or have received a million phone numbers, the first thing I'm going to figure out is who can I scam? I can only scam the people that pick up the telephone from legitimate phone numbers. So I'm going to start calling all of these numbers. And if someone answers that call, then I'm going to put a star by that name because I know that this is a legitimate working phone number and someone in this house answers that phone. So I'm going to star that number. It's going to become more valuable to me and I'm going to call it over and over again. But in addition, now that it is a more valuable number, I'm going to sell this number to other scammers because someone at this number picks up the phone and it's more likely that we'll be able to scam someone there. So every time you pick up the phone, you are legitimizing to a scammer that this is a valid number and that someone here picks up the phone. So I'm going to call it more and more and I'm going to try to scam this person. If I never pick up the phone, then eventually they're going to stop calling because they're going to be wasting their time. Now, in addition to people telling me that they harass the scammers and they don't mind picking up the phone, what they also say is, well, Shawn, I'm really smart. I've got this degree, I've got that degree. I can outthink these scammers. But unfortunately, that's not always true. And those same people end up calling our hotline and they end up saying things like, I knew better, but they caught me off guard. I was doing two things at once. I'd just woken up. I was running crazy with the kids or the dogs, and they just caught me off guard. And this is what scammers know. They know that if it's your habit to pick up the phone, that one day they're going to catch you off guard. And so by habit, you're going to pick up like you always do. And they're going to say the right thing at the right time, and they're going to catch you off guard. And if they don't get you today, that's what they're thinking. I didn't get you today, but you pick up every day. So I didn't get you today, but one day I'm going to catch you off guard. And that's why they keep calling back. So we say don't answer unsolicited calls, but also we say don't automatically trust your caller ID. They have a technology that's called spoofing, where they can make that caller ID look like any number they want. And so if you've seen this, which I'm sure you have, the number coming in on caller ID has the same area code as you, and sometimes the same first three-digit exchange as you, making you think that maybe this is someone that I know. Maybe it's someone local. Maybe it's someone from the church or from the neighborhood. And you end up answering that call only to find out that it's a scammer. And so, again, they're trying to trick you. They want to make that number look familiar to try to entice you to pick up that telephone, to try to verify that someone lives there and they can scam that person. So we say don't automatically trust your caller ID. They had actually gotten so good at this back in 2021 that they were spoofing the Social Security Administration. So when people were getting that phone call, there was an 800 number showing up on their caller ID, and underneath it said Social Security Administration. So people were picking up, thinking they were talking to the SSA, and really they were talking to a scammer giving out information. And so we remind seniors, as was said earlier, that government agencies will not give you an unsolicited call. IRS is not calling without letting you know. Social Security Administration and even Medicare and other agencies do not give unsolicited phone calls. And so if someone calls unsolicitedly and they say they're from one of those agencies, you can hang up because 100% or 89.9% of the time, you're going to be talking to a scammer. And then finally, we ask seniors not to pay for things by obscure payment methods. most things that we pay for by credit card, debit card, by check, or by cash. Um, if someone's asking you to pay for something, and especially someone you don't know, if they're asking you to pay by an obscure method, and when I say obscure method, I mean things like wire transfer or money order or Bitcoin, or even a gift card. If they're asking you to pay by one of those methods, all of your red flags should go off because these are ways that scammers can receive payments that are impossible to trace, which makes the money impossible to get back. And that's why they ask for those types of payment. So if anyone ever asks you to pay for something by an obscure method, you definitely want to put a lot of questions behind that because it's likely you could be talking with a scammer. So those are ways that we prevent the government imposter scams. When we talk about preventing the durable medical equipment scams, what we ask seniors not to do is don't agree to receive any free things from people that call you on the telephone. I love to tell a story about my mom and my three brothers. We have four boys in the family. I'm number two of four, and my mom would send us outside to play in the mornings, and she would say two things to us. She'd say, "Don't talk to strangers, and don't be taking candy from strangers. Don't take candy from strangers." And so now my mom is 74 and she's retired. And when the phone rings, I say to my mom, "Mom, don't talk to strangers." And don't take free medical devices from strangers when they call. I know that when these folks call, they are super sweet on the phone, they are super nice, and they just sound like they want to be super helpful. But these folks don't know you. They don't know who you are. They don't know what medical conditions you have. They don't know what medications you're on. And what they could be giving you, as benign as it seems, could be more harmful than helpful. We have doctors that have told us that they have patients that walk into the office with these braces that they get from people over the phone, only to find out that the brace is too small or too large and it's doing more damage than it's doing good. And so accepting free things from people over the phone could be super dangerous for you. We also say don't answer personal questions or share any type of medical information over the phone. Don't even verify anything. As we talked about earlier, these scammers are getting your information from things like data breaches, so they're stealing information. But if you've ever gotten one of those data breach letters, it'll tell you very specifically that we think the scammers or the robbers or the thieves got away with things like your email address and your password or your phone number and your home address. But they're telling you that they're very specific things that they've gotten away with, and they haven't gotten all the information. So when a scammer gets a part of the information, what they do is they call seniors and they use that little piece of information to try to legitimize themselves. And then they start to ask questions so that you end up filling in the blanks that they don't have. They want you to fill in the blanks because the more information they have about you, the easier it is for them to scam you. So they'll call and they'll say things like, "Is this Mrs. Jones? Do you still live at XYZ address?" You say yes. "Do you still have XYZ email address?" You say yes. And then they'll say, "Can you verify your date of birth?" And then you start to give them information unknowingly, really filling in the blanks. Or they might say something like, "Is your date of birth June 8th, 1994?" And then you'll end up saying, "Well, no, no, my birthday is June 7th, 1950," or whatever it is. But again, they start to trick you into giving them information. And so, if people are calling you and you don't know who they are, do not answer any of their personal questions. Do not verify any of their information. And then finally, if you need something, talk to your doctor, talk to your pharmacist. They can get you what you need, or they can direct you to the right place to get things. I even say that if you see something on television that looks interesting, do not call the people on television. If you call them, they're going to get your name, your phone number, your email address, and you'll be on their list forever. They'll call you, they'll badger you, they will beat you up. But do not call those folks. If you see something, talk to your doctor, talk to your pharmacist. So those are ways that we prevent the durable medical equipment scams. When we talk about preventing the genetic testing scams, we say don't participate in any unknown procedures and confirm any unexpected deliveries. When we talked about the genetic testing scam, we talked about the phone call that you might get. But what we've seen happen with this particular scam is that sometimes the scammer has enough information about you, and what they'll do is they'll reach out to your doctor tell your doctor that you want this particular test. They usually do this by fax. They'll have the doctor sign off and fax it back to the sender. Then they put that piece of paper in the box and send you the box. We actually had this happen to a young woman. She had received a box in the mail, and the minute that it landed on her front porch, as she retrieved it, she got a phone call. And that's because the scammers were tracking the delivery of the box. She got the phone call, and the people on the phone said, "You just got a box from your doctor. He wants you to take this test." Open the box, and in the box, you'll see his fax form. And sure enough, the document where he had signed was in that box. And so she was still skeptical, but she never called the doctor's office. She actually called our office. It was like Friday afternoon. When we got her call, it wasn't until Monday, and we called her immediately. We said, "Ma'am, that is a scam. Do not participate." She said that over the weekend she thought about it. She participated with it. She took the box to UPS. She said, "I'll call you back." She actually went to UPS, was able to get the box back. But basically, they had called her doctor's office, scanned him this document, and put it in the box, trying to convince her. And she never called her doctor's office to confirm it. So if you get something and you're not sure of what it is, and it's a claim that it came from your doctor's office, you want to call your doctor's office and confirm that it's something that he actually legitimately sent you. Typically, your doctor is not going to send you something that he hasn't talked to you about first. And so, but still, if you get something, you still want to confirm that with him. But also, if you need something like a genetic test or you want to take a screening, consult your physician or your pharmacist. They can talk you through the legitimate steps to get those things done. So those are ways that we prevent scams. When we talk about detecting scams, we ask folks to review your account statements regularly. Now, most people will look at their bank account statements on a regular basis. Most people look at their credit card statements on a regular basis. But what we find is not enough seniors will look at their Medicare summary notices or their explanation of benefits when they arrive. These are the documents that your insurance companies will send you to verify that the things that are happening on your account are things that should be happening on your account. What scammers are able to do now is they can steal information about you and you never even know it. Put in false claims to Medicare or your insurance companies, and then you never know that it's happening until you get these statements. The medical companies or the insurance companies, what they want is that they want you to receive your services fast. They want doctors to get paid in a timely manner. And so a lot of these initial claims are all automated. They go through computer systems. People aren't looking at these, but then they send you the documents because they're trusting you to verify that this stuff that's happening on your account are the things that should be happening. And if something on that document looks fraudulent, then they want you to contact them so that they can remove those things. Because money is passed back and forth between these companies electronically, if they pay something out, they can also pull that money back if they need to. And so when people report these types of things, it's super helpful in keeping money in the system where it belongs. And so when you get these statements, what you're going to be looking for are going to be charges that you didn't make or services that you did not receive or that you don't recognize. You're looking for merchants or providers or facilities that you don't recognize, because all of that information is going to be on the documents. But then also you want to make sure that your account information on these documents is correct. Unfortunately, we've seen where in doctors' offices, people put the wrong information on the wrong person's account. If there's a Mary Jones with A as a middle initial and a Mary Jones with a B as a middle initial, sometimes Mary A's information can end up on Mary B's account. And so you want to look and make sure that all of your account information is correct, because again, it could indicate that someone is doing something fraudulently, or there could be just errors in the system. And we would hate for that to happen if you end up in the hospital and people start to medicate you for a condition that you don't have. So we say you have to detect those things, but then also if you see something that looks unfamiliar or strange, you want to report those things. A lot of times, a lot of these errors or these incidences end up when people get their doctor's bill or they get their Medicare statement. And you want to report those things. And so, you can always call your provider and ask questions. Sometimes the bills just look very different from provider to provider, and they can explain those things to you. Sometimes you can call the billing department and ask questions, or you can call your insurance company. But you can also call the Senior Medicare Patrol. Our 800 number is there on the screen. And you can call us and we can help you through the process. We say sometimes we'll also triage you, meaning that if you call us, we may not be the right person, but we'll get you connected to the right person. We hate to see you make 17 different phone calls if you don't have to. And so when you call us, basically what happens is we just collect information from you. We gather information to open up a case. And so we ask you what's going on and what you think might be going on. If you're looking at particular documents, we'll ask you to get us copies of those documents so we can look at them together. And then once we assess the situation, then we can do one of three things. One, we can give you some simple instructions about what you can do with your provider to get those things straightened out. Or we can call and make phone calls with you to your provider so that there's a three-way call happening and you have an extra pair of ears and an extra and an advocate on the phone with you. Sometimes people will tell us that, well, I've called my provider, but their office staff was really rude to me and I still didn't get what I needed. But somehow when we get on the phone with them and there's a third party, people become really, really nice. And so we know that that's a phenomenon that we want to help seniors through. And then sometimes we might say, you might have to call Medicare. And seniors will say, if I call Medicare, I'll be sitting on the phone for 30 minutes before someone gets to me. I don't have that type of energy or time. You give us the proper authorization, we'll make those phone calls on your behalf. And so we'll call Medicare or your doctor or your insurance company or whoever. And then we'll call you back and say, okay, this is what they said, and here's what we need to do next. And so again, we can give you instructions about how to make that call. We can call with you, or we can call on your behalf. Now, if sometimes there are things that are happening on these accounts that are too difficult for people on my staff to handle, and so what we do is we have access to Medicare investigators that are internal and not accessible to the general public that we can forward your case to, and they can do investigations. An example of this would be if your name gets confused with someone else's name and your information and their information starts to end up on your account or their account. We can't handle those things, but Medicare can sort through and get those things figured out. And when there's actual fraud taking place, we also forward your case to the Office of the Inspector General, which is the federal law enforcement around Medicare issues. And they can do some investigating. It's super important when you guys report this type of stuff because it's super helpful in helping them find the criminals. As I said earlier, reporting becomes important. And a lot of times seniors don't like to report because, especially if they feel like they're a victim of a fraud or a scam, because they start to think, well, maybe there's something wrong with me. I'm getting old. Or if I tell my kids, they're going to want to take away my rights and my privileges and get into all my business. And the problem with that is that's not always the case. These scammers are professionals. We know that we get trained by the FBI each year. They come to our annual symposium and share with us some of the things that are going on. And we know these scammers originate overseas in many, if not most cases, but they also start them at very young ages. And at the very first step, they're sitting them down in front of social media and teaching them to identify who is a good victim. But then they start to teach them how to talk to people over the phone. So they get on the phone with you and they know exactly what to listen for. They know exactly what to say. And so there's trained professionals in keeping you on the telephone. If you've ever seen a news broadcast of someone sharing their experience with being scammed, they say things like, they had me on the phone for 30 to 45 minutes, or they had me on the phone for 2 hours. And that's because they know exactly what to say to keep you engaged and to scam you. And so if you ever felt like you've gotten scammed and there's something wrong with you, don't feel like there's something wrong with you. These are professionals. They know exactly what they're doing. And so we love when you report because, as I said, this is a national program and we share a national database. And so when I put information in from Virginia, from scams that are happening here, the same things are being done from various parts of the country. They're putting things from California and Florida and Wisconsin and all the states into this one system. And what the Office of the Inspector General does is they start to look for patterns. They look for doctors' names that show up over and over again. They look for facilities that show up over and over again, or the descriptions of the scams that are happening that show up over and over again. And that helps them trace back and find out where these scams are happening and prosecute those individuals that are committing these scams. And so reporting is very important. It shouldn't, if you get caught up in the scam, you shouldn't feel bad about it because, again, these are professionals that you're dealing with. And ultimately, reporting it helps us catch the scammers. And so with that said, I'm going to go ahead and open up for questions if there are any.
All right. First question is, what's the logo that we're seeing instead of your face? It
Oh,
looks,
I'm sorry. Are you not seeing my face?
no,
Don't
it
think I
looks
had.
like a triple VA.
I am so sorry. So this is I'm on Zoom and I also volunteer with Virginia Ability, which is an organization that supports individuals with disabilities in getting employment. And so I think that's what I thought my face was on there, but I'm going to go ahead and stop sharing my screen right now. That's okay.
Yep.
So my apologies. There I am. But yes, so that's what that logo is for. My apologies.
Now, you talked a bit about how to handle phone calls from people you don't recognize. What about text messages?
Mhm.
People are getting scam texts. What are the dangers of opening a text from somebody you don't recognize?
Great question. So we actually do a whole presentation called "Can You Trust That Email?" where we talk about text and email scams. And so we can do that one day. But however, to answer your question, opening a text message from someone that you don't recognize, opening it, there's not really a lot of danger to it. However, if they send you a link or they provide you a phone number or ask you to download something, that's where the danger comes in. You don't want to click on any links. You don't want to call any of their numbers because while they say that the number is going to, one place, it could be going somewhere else. For example, if they say that they're FedEx and they're going to verify your FedEx information and they give you a number, the number they're giving you probably is not going to FedEx. And so the information that you could be verifying could be giving a scammer more information than they need about you. But also, clicking on any of those things could be downloading malware to your device. And of course, that could become a problem because that could give them access to your device or it could send information to their devices that could be important and that you don't want to share. So, again, opening it is not a problem. Clicking anything is a problem. When you go to delete, sometimes it'll ask you to delete or delete and report. You always want to do delete and report. And I'll tell you why that works. One of the groups that we work with is the Attorney General's office and their community advisors. And so we often end up doing presentations with them. What they shared with us is that when you hit delete and report on your phone, it sends a message to your carrier, and then your carrier gathers that information about where those emails or where those text messages come from. And they send that to the OIG, the Office of the, I'm sorry, they send it to the AOGs, the Attorney Generals in each of the states. There were about 20 Attorney Generals that were part of a lawsuit where they were able to identify about 5 companies that send out these mass emails. And they were able to send them cease and desist letters. And then that kind of sets them up to be able to prosecute these companies. And so when you report, it does do some good and it does help us catch the criminals. But great question about the text messages.
One thing I wanted to throw in about emails is when I get one that appears to be from like Medicare, if you hover your cursor over what it says from Medicare, you'll see the actual address that it was sent from. And if it's not from Medicare.gov, delete it without even opening it.
Agreed.
All right, next question. Is Doge interested in this area of fraud and waste and concern at all?
And when you say, are they interested in this area, meaning I don't know what Doge is. I don't know their whole mission directly, so I'm not sure exactly how deep they're going to dive into, what we're doing at the S&P. But I haven't gotten any information about how they're going to affect this particular area.
Okay. With the reported reductions in government employees, including inspectors general, are scam cases taking longer to be investigated? Are you seeing anything like that yet?
Great question. So I don't know if I have a correct answer or a right answer to that. So what we do, fraud cases take a long time anyway. When we put in a case or we put in information, OIG never gets back with us and tells us, hey, this helped or whatever. We have to find those things on their website. And it could be a year, it could be 2 years, it could be 10 years, depending on the level of the scam. I imagine with less staff that's going to hinder their ability to do that more efficiently. At this point, what a question that I often get around this is, how is my program affected by some of the changes? The program that we offer falls under Medicare, and the promise has been we're not going to touch Medicare. So at this point, while the restructure of the Health and Human Services Department may affect us from a mechanical level, at this point, we haven't seen any threats to the funding for this program.
Okay. On a related note, it seems like every day or every other day, there are reports that somebody is threatening to mess with Medicare or Medicaid or Social Security. Are you seeing new scams popping up along the lines of, your Medicare benefits are at risk? Click this link to confirm that you're still eligible. And, now they've got you.
Great question. And no, we haven't seen that yet. And you may be giving scammers ideas now, but no, we haven't seen that yet. But we suspect that that's exactly what they will do. If you guys remember a few years ago when we were talking about the loan forgiveness for student loan debt, as soon as scammers saw that, they started setting up these little companies that will help you get rid of your student loans, when really there was nothing you had to do. The government was doing everything internally, but they were making people believe that they could help them for a small fee. And so with that said, we expect that if there starts to be a threat to Medicare, that you will start to see those folks pop up and try to convince you to pay them to help you with whatever process that needs to be taken. So great point and good foreshadowing there.
Okay. And how big is the Senior Medicare Patrol? How many people are involved?
Great question. So, as I shared, it's a national program. Every state has a director like myself. So, I'm the state director for Virginia. I have an internal staff member who's our volunteer coordinator, and then we work through the AAAs. So, in Virginia, our staff hovers between 110 to 130 people each year. Um, Every state, however, manages the program differently. So at the very least, they're going to be two people connected with the program, and then their whole slate of paid and volunteer staff. And so if you just multiply Virginia over 50 states, then we're looking somewhere in the tune of what is that, 5,000 folks around the country that are paid and volunteer staff for this program.
You mentioned volunteer staff. What are the qualifications to be a volunteer?
Being willing to provide some time. So our volunteers do a number of things. So sometimes we have some volunteers that are local that'll come into the office and they'll help pack bags that we take to events. We have some volunteers that are away from the office that we call our core volunteers. They're not affiliated with one of the AAAs, and they'll man tables at various events around the state. So if you're like in the Front Royal area or the Arlington area, when we have events that come up in those areas, we may need an extra person to who's learned about the program that can hand out information at an event. And then some of our volunteers actually volunteer with the AAAs. And so they'll go into one of the AAAs and become part of their what we call S&P team that may man events at tables, they may answer some phone calls. And so we have various levels of volunteers. So if you are interested, you can always call our 800 number. I'll pull it back on the screen, or at least I'll share it with you. Always call our 800 number, tell us you're interested in volunteering, and Karen, our volunteer coordinator, will get in touch with you and talk you through the process. You do have to pass the background check.
Right. So I guess you answered the next question. When someone calls the 800 number, do they get an actual live human being on the phone?
Unfortunately, they do not. We actually screen all of our calls as well because we are prone to scam callers also. And so all calls, for two reasons. One, we want to legitimate the call, meaning that we're going to screen the call, but also we keep a record of all the calls that come into our hotline. And so we ask you to leave your name and your phone number and give us 24 to 48 hours to get back with you.
What kind of scam calls do you guys get?
Just the random people calling and asking us to, you know, uh, we don't answer them. So, I mean, I did answer one, and it was, the typical person is Mrs. Jones there or what have you, but they get into their little spiel. But again, we send everything to voicemail, and we'll get a rash of calls where they're only 20 seconds long and no one says anything, which we realize are scammers. But again, we don't want to perpetuate them continuing to call here because someone answers the phone.
All right. And Steve has just posted your website and 800 number.
Perfect. Thank
So
you, Steve. Appreciate that.
you mentioned three primary Medicare scams. Are there others that aren't happening as much but are still of concern?
Yeah, so there's some scams that are happening, and the way that most of these scams are happening are uh, things are showing up on Medicare documents or EOBs, explanation of benefits. So a lot of calls that we receive, people are getting their explanation of benefits, and things like urinary catheters are showing up that they did not ask for, that they don't need, that shouldn't be on there. Urinary catheters, some diabetic testing tools or supplies are showing up on people's forms. And what's the other thing? There's a third issue. Also, medical braces and other pieces of medical equipment. And so, definitely detecting or looking at your medical statements is one of the best ways to identify scam happening. Anything that's happening on your account is going to show up on that statement. And that's where we're seeing a lot of things happen. What scammers have gotten smart to is that they realize that people don't look at those statements. And so rather than making the phone call and interacting with someone, which often tips them off that there's a scammer afoot, they just put these claims in. They steal as much information as they can and put these claims in hopes that people don't look at those documents. And they know people don't. And so they end up getting away with the scam and the money.
So do you have any idea where these scammers are physically located? Are they worldwide or do they tend to be more local?
Great question. Uh, Most of these scams originate overseas and especially in some of the poorer countries. Some of the physical locations are known, many are not. What we've also learned about these scammers is that we get angry at the people that call us, but many of those folks are actually being trafficked. In these poorer countries, people will move great distances to try to find good work. And so these people, we found that they're people that are applying for jobs in the neighboring city or the neighboring country. And they go to these jobs. And when they get there, they get their passports taken and they get put on this compound where they are being forced to make these phone calls and to make the calls to individuals like yourselves, and they're forced to make a certain amount of money or a certain amount of calls each day, which is why they tend to be so tenacious. And when they don't meet up to the expectations, then they're often beat or tortured and sometimes even killed in the process. And because these schemes bring in a lot of money to these third world countries, law enforcement and the government are not helpful in helping us try to stop these scams from happening. If you go to YouTube and type in, something like scammer, uh, anything about scammers and some of the scammer compounds or scammer trafficking, some videos will come up and share with you some of the things that some of the undercover documentary workers have been able to discover, as well as FBI agents and other service agents. But sometimes these scammers are, like I said, in foreign countries in most cases, and many times they're being forced to do this work against their will.
We actually just got a comment in saying that exact same thing,
Excellent.
talking
Yeah.
about people being forced to do this.
Yeah, it's unfortunate. However, there are, when you get items from some of these scammers, there are physical locations in the States where they actually pretend to put up places. Sometimes they're in strip malls, and if you go to that strip mall, that the space will be empty, and they actually own the space and the space next door to it, or they're using the name or the location of that space for a cover. And they're able to move from space to space and change name to name very quickly, which is what makes it difficult for the cops to track them and pin them down.
Okay, we're about 5 minutes to 11. And I wanted to ask, suppose I get a box delivered with some of this durable medical equipment that I never asked for. Is there anywhere I can donate it that it might actually do some good?
That's a great question. My only thought would be maybe a local nonprofit with things like braces. So there's an organization called the Free Foundation, but they typically only take equipment like wheelchairs or walkers or even like stools that you'll sit into a bathtub. They don't typically take braces. Most of the things that these folks will send, the scammers, are going to be things like braces. And it's really difficult to donate those anywhere. I would say if there's a local nonprofit that you know of that accepts that type of stuff, then that's one thing. Or maybe even donating it to a local health clinic or something where it may be given to someone that's in need.
Okay. Somebody commenting, it's hard to deliver a wheelchair.
It is hard to deliver a wheelchair. And that's why scammers usually don't deal with things like that. They deal with stuff they can drop into a box, or that can be dropped into a box, I should say.
Yeah, and I can't imagine it's all that easy to donate a box full of catheters to
Yeah.
some random charity.
I'm too lazy to type, but maybe places like the Arlington Free Clinic could use equipment that you have that you don't need.
That's a great point. Yes, ma'am.
Yeah, and Wendy did just publicize that AMV does have some things like wheelchairs, walkers, and canes for people if they need them, temporarily or permanently.
Right.
And contact
Thanks.
the office.
Right. Thanks, Gary. We have a room full of probably now 10 or 12 of those silver metal walkers, 3 or 4 wheelchairs, one rollator, one knee thing. We actually are at the point that we can't accept any more donations until we start moving some of it out. But we can't take anything that's, been used, like shower things or stuff like that. And many clinics and others won't take those kinds of things as donations either.
So any other questions? Gary, it doesn't look like
I
it.
don't see any more.
Shawn, this was fabulous.
Well, great. I thank you all for your time. And again, thank you for the opportunity to share. And please reach out if you guys need anything, and I'll be glad to help out.
Yeah, is your email the same as it was when I had you on the show 4 years ago?
Yes, it is. It's not changed.
Okay, because I'm thinking that since you were on the show in 2021, might be time for an update. So I'm looking at June programs, so I will be in touch.
Okay, sounds great.
Yeah.
And I'm going to put my email address here in the chat. Let me make sure I
that
send
would
it
probably
to
be
everyone.
helpful.
And that way, if you have something, email is usually faster to get to me. If you want, I'm giving you guys this information. If you guys want to get to me, you can email me and let me know that you left a phone message, or say that you want to set up a phone conversation if something comes up, and I'll be glad to do it that way as well.
Okay, excellent. I was just writing that down as well. So anyway, just to remind folks, as I said, this was fabulous, Shawn. Really helpful presentation for all of us. And next week, we will be talking with Susan Thompson Gaines. She is a kindness activist. And so the program is going to be about advocating for kindness. So we could all stand to have a little more kindness right now in our world. So I think that will be very apropos. But meantime, it's 1 minute before 11. And so thank you again, Shawn, and thank you all for joining us today. And we'll see you a week from today at 10 o'clock. So have a good week and stay safe.